Strokes kill more than 300,000 of us every year, often without warning. Stroke is also the #1 cause of adult disability in America. But what if there was a way to identify a significant risk factor, one called the quiet killer? The answer could lie with an amino acid called homocysteine. It's a byproduct of a normal diet, but large amounts of it in our blood can be deadly.
The evidence is emerging to say that yes, hyperhomocysteinemia is a significant and independent risk factor for vascular disease, and particularly for stroke.
A stroke occurs when a blood clot blocks a blood vessel or artery, or when a blood vessel breaks. That interrupts blood flow to an area of the brain, and soon cells begin to die. So do the abilities controlled by that area of the brain, including speech, movement, and memory. A decade ago, only a handful of researchers were studying homocysteine. Its link to heart attacks has been well established. But now, new findings suggest homocysteine has a larger role in our health. In a recent clinical investigation published in the Journal of Endovascular Therapy, Dr. Heenahan studied high levels of homocysteine in 230 patients with vascular problems. Other studies conducted by Dr. Amy Tofigi, a University of Southern California neurologist, studied the effects of high homocysteine levels in over 12,000 patients, also with vascular problems, and the results were startling.
The added impact of hyperhomocysteinemia and hypertension has been shown to have an effect of up to 14 times higher risk of stroke in comparison to a person without either.
A larger study was done in China and dealt specifically with homocysteine and stroke.
We conducted a large-scale clinical study and found that both hypertension and homocysteine are risk factors for stroke. When these two factors together can increase the stroke risk by 12 times.
Stroke is a leading health problem in China. Mortality can be twice that of Western nations.
The study is so important that China SFDA approved a new drug which can treat both hypertension and high homocysteine, which will protect the hypertensive patient from the stroke most efficiently.
Some doctors say that monitoring homocysteine levels should be as routine as checking cholesterol.
Having one's homocysteine level measured is as important as having one's cholesterol measured, because the impact is as great in contributing to vascular events such as heart attack and stroke.
A homocysteine test is an excellent method of determining vascular health, but perhaps it is most useful in determining the risk of stroke, especially in patients with high blood pressure. Homocysteine is easily measured with a simple blood test, and treatment is an adequate intake of vitamins, B6, B12, and folic acid.
We advocate that hyperhomocysteinemia is a significant and independent risk factor for vascular disease and is easily treated and should be treated.
Homocysteine levels can be a dramatic diagnostic tool and a life-saving one, especially for those of us or the ones we love who are at risk of stroke.